My C-section was scheduled for a week prior to my due date. So I went in at 39 weeks, praise God. And I'm out of breath. I will be doing a video on how I'm losing weight. I lost all my my post-pregnancy weight, and I'm still losing pre-pregnancy weight I added on to myself before I got pregnant. But anyway, I went into my C-section on my 39th and 1 day, my 39th week of pregnancy, and I had to stay in the hospital for about 3 to 4 days. And now having a C-section is no joke. The recovery is 8 weeks. And so we went into the hospital. I couldn't eat, I couldn't drink. I think after 10 o'clock at night, and my C-section was at 7 o'clock. And when we got there, they put me in the triage section, basically just to get me all prepped up for going into the OR. And I'm sad because they would not allow us to take any video in the OR. And I'm like, oh, I want a video of my baby, and I want a video of him getting his umbilical cord cut and all that. But they allowed me to see him coming out with the mirror over the curtains, but I couldn't take any video. We got some pictures after they wrapped them up and cleaned them up. But anyway, they prepped me in the OR, put a monitor on to monitor his heart rate, gave me some nasty drink. I forgot what it was, and I wish I would have said it in the video, but it gave me some kind of drink, I think, to be able to see the baby when they scanned my belly with the ultrasound before I went to the OR. And then in the OR, I was already ready for the spinal tap, because I had a spinal tap when I was, I want to say that too, when I was in when I had my myomectomy surgery. They gave me a spinal tap, and which numbed my legs, epidural, and that numbed my legs before I went into surgery. And so after my surgery, my legs, they had to put sleeves on my legs to massage them, to get them to come back, because they was taking for a long time for the control to come back, the control of my legs to come back. It took a long time for the medication to wear off. So when I had my myomectomy, I was in the hospital for about 4 days, and it was really difficult because they wanted you to cough and to make sure that everything is functioning properly, to make sure that you're able to push, in which I had problems doing, having a bowel movement, having number 2. So they gave me some things to help that along, and then they wanted me to walk, and that was really hard. They wanted me to walk around to get the blood flowing, so I wouldn't get any blood clots. And I remember my husband, my then boyfriend, coming in, and he's really silly, and I told him, whatever you do not make me laugh. And he did anyway, and I was so angry because it hurts. And when I had my myomectomy, the nurses had to wash me with give me a sponge bath in my bed, because I wasn't really able to move for those the first day or couple of days. And so after my surgery, my doctor said, you can take the rest of the semester off. I advise you to do that. And I'm like, no, because my program is already 5 years and I will not be there any longer. So I went right back to school the next semester. So I didn't have that much recovery, but it was just different with having a C-section. We having the C-section. Well, I'm gonna get to that. Let me first explain what happened. When I got to the OR, I got my spinal tap, and I was already prepared for that. You gotta hunch over and be really still while they put this needle up your spine, in between your vertebrae. And then I laid down, and they had me on a tilt I forgot why the tilt, let me look up what the tilt means. Hold on. Up? Okay, yeah, during the C-section, say up. Yeah, up. He said up a little bit. This little baby, he talks a lot. But sometimes like, oh, I don't know what to say. Anyway, so during my C-section, they had a left lateral tilt. Say camera? Camera? Maxwell. Where's the light? 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 Point. Where's the light? Maxwell. Light? Sometimes he points at the light if the light's on. Maxwell, how old are you? You sleepy? How old are you, Maxwell? Maxwell, how old are you? How old are you? 1. Okay, so I forgot why. I think it's something with compression. I did have compression socks too, but the compression socks are for the legs, and the lateral tilt, I forgot why, but I remember looking at, some doctors don't even do it because they think it's outdated. But anyway, so during my C-section, it took the doctor maybe like, it took him forever, versus someone who didn't have a myomectomy. I had a lot of scar tissue, so it took about 45 minutes for him to open me. And mind you, when you have a spinal tap, sometimes, I think the epidural, my lungs, I couldn't really feel, like, I couldn't expand my chest to breathe, so I'm turning my head sideways trying to get air, and it's really hard to get air, and that was really irritating. And I was just trying to remain patient and just praying. And another thing that really irritated me was I wasn't able to wiggle my toes, and this next one is gonna have you guys, I don't know how open I should be, but I could not clench. I could not clench my vagina. I couldn't squeeze my vagina. And I'm like, I can't feel down there. This is, if you never had a like this open surgery on your abdomen or your uterus, whatever, it would have took him quicker to get in, to get the baby, but it took a long time because I had a lot of scar tissue. So he had to remove that scar tissue before he could get to the baby. Maxwell. Before he can get to the baby. So anyway, I think it took about 45 minutes, and I'm like, I want my baby. My delivery, my C-section time, the time to be in the OR was 9 o'clock, but my doctor was in another room with another baby who was about to push. So I'm on the table. Initially I was on the table getting ready. Thank God they didn't put the epidural in, but if they did, he would have operated on me. But the lady down the hall was pushing, so they told me, oh, we gotta wait, let's go back to triage because the doctor is in the process of delivering another baby. So we had to go back to the triage section and just wait. So now that I'm finally on the table, I have to wait another 45 minutes to see my baby. I think it was an hour, maybe a little under an hour when before they brought me back in to the OR. So he finally got to the baby, and I was so excited, and my husband was too nervous to see, because I'm a person that's known to watching like ER shows and surgery shows, cosmetic surgery shows, and I love looking at that stuff. And I don't get really like squeamish when they cut and all that stuff. I like the doctors and HBO show. I think it's on, not HBO, it's on, I don't even have HBO. The doctors, Dr. 90210 or something like that on the E network. And I love the Discovery Health channel. So I'm like, yeah, and plus it's my baby. I want to see my baby. So the nurse, the anesthesiologist asked me that I want to see. I'm like, yes. So she took a mirror you know, my phone is the mirror. She took the mirror, and I'm laying down, and she tilted the mirror so I was able to see the baby being delivered. I'm like, I want to be one of the people to see him being, you know, taking out my belly. That's my baby. I didn't get a chance to see everything else, him getting cleaned up and weighed and all that stuff, like I did with my nephew. You know, like a lot of women, you know, do when they have a vaginal birth, or in other hospitals. Some doctors are okay with having cameras and all that stuff, but my doctor wasn't. So I guess it was a liability issue or something. Something went down wrong. He didn't want it on camera. Is this little baby coming back? Okay. Like, no, I'm almost done. So anyway, I had the baby, and he was born on at 10:53 a.m. And I was so happy. So we were then shipped to another room that I stayed in for the next 3 to 4 days, and they didn't have a nursery. I didn't know until I went on the tour before I had the baby, like a couple months before that, they don't have a nursery anymore, and the baby stays with you. So I mean, I love that, but it's really hard when you just had surgery and you're tired, and the baby's crying all night, and I'm like, I have to twist and turn to grab the baby from his crib to my bed, and they wouldn't allow me to have the baby in the bed with me, but I was just so tired, and I'm like, okay, you're gonna sleep on top of me tonight. So he slept on top of me many times, you know, and we did chest to chest, skin to skin all the time. And there's times where I almost dropped him. Like, it was nothing but God that I'm asleep and I can feel him falling. I'm dropping him mid-air, or the nurse comes in and my baby's like head down, you know, and I'm asleep. It's just so hard. Like, oh my gosh. My husband did stay with me the first night, but he had to work. My husband worked. He had to be at work at 5 in the morning, so he couldn't stay with me every day, and then, you know, family members had to work and all that stuff. So it was just me and the baby for most of those nights. So I decided to breastfeed him, and my milk didn't come in until maybe that last day. I took a nap and woke up, and I took a nap and I woke up and I was full. I'm like, oh, my milk. I'm like, what's going on? What's going on? My milk came in, and so he was born 6 pounds 12 ounces, and then he dropped to 6 pounds 5 ounces, and I was so big. I was already overweight. I was 196, 198 when I got pregnant, and so I gained I gained about 25, 30 pounds. I hear a little baby. Well, he laughed because he got away. Come here. Yeah, he's big now. He's in the 96th percentile now. But he was born on the smaller side. Here. Okay. Here. He was born. Mark, can you? I'm trying to. Okay. Okay, round 5. I don't know. Anyway, where was I? I'm in the flow, and I'm like, what was I saying? Okay, so he was born 6 pounds 12 ounces or 11 ounces, dropped down to 6 pounds 5 ounces, and because I just had colostrum, and I just nursed often until that milk, my milk came in the isn't that something? I need to wrap this video up because my 2 cards are full. I am not ready for this video. So anyway, my milk came in, and so now I nursed. I'm still nursing. I'm still pumping and nursing, and he's 13 months, and I began giving him solids at 6 months. But anyway, my doctor said that my womb was too little, too small to hold his genetic potential. My husband is like 6'3", 6'2", and in the 200s. for weight, and he was born at 8 pounds 3 ounces. So, and my dad's side is not small at all. So, and I'm 5'7", and I'm not a small person, but he's pretty big now. But I gained 42 pounds, so 196 to 198 plus 42 pounds. I was like 238 when I had him. So anyway, what else I want to say? That's my birthing experience. You know, it was painful. I had many doctors and nurses coming in, checking my belly, pressing on my belly, looking at my incision, pushing the belly to make sure all the fluid is out. And that was painful. I almost cried. And no one told me that you have to pack. My mother told me like a few weeks before when I was packing my hospital bag to carry some sanitary napkins. I didn't know you bleed you bleed. It's not all blood. There's other type of fluid in there for like weeks after, or yeah, a couple weeks after you give birth. So that was interesting, you know, having the nurses come and like help you clean up and stuff down there. So compared to my myomectomy and my C-section, the myomectomy was painful, but the C-section is I feel like it was more painful because my belly expanded out so much. I lost a lot of muscle and all that stuff. So I had to you know, get that muscle back, and you're caring for a newborn baby. So you're doing a lot. You're doing a lot, but I wouldn't trade it for anything. I am so happy to be a mother. I love my son so much. He is such a great baby, a good baby, well behaved. He's just, I'm so happy. And I look back and I think, what was I so scared of? What was I so scared of? I love him to life. I love him so much. And I look forward to having more babies, giving him a sister or a brother. I feel like I'm gonna have a girl next. I wanted twins. On my dad's side, my dad was a twin. There's twins heavily on my dad's side, and they say fraternal twins run on the woman's side because 2 eggs have to drop. And I think identical twins are just something random that, you know, that's what doctors say. But I wanted twins initially, like a girl and a boy, and I'm like, okay, that's a wrap if I have a girl and a boy. But God gave me what I could handle. And yeah, I love my baby, but I just wanted you guys to be encouraged if you have fibroids, or if you had fibroids, or you have to have a C-section. Just, you know, pray over yourself, pray over your baby, believe God, trust God. Babies are a gift, and just, you know, just appreciate what you have and what you're going to have, and just speak things over yourself, and just, you know, God gives you your heart desires, and I love my family, and I'm trying to think of anything else I want to say. Of course, I'm trying some foundation right now, and this is off topic. I'm trying foundation right now, and it looks good on this iPhone, but on the camera it looked pretty bright. So we'll see how it looks on the day, at the day's end. And my hair, I'm trying a new product too. So check out my hair channel, Parisin85, Parisin85, if you want to see some wash and go videos, other hair videos. And I would like to post some makeup tutorials. I'm not a makeup expert, but I'm trying to get into finding like a nice foundation, and I'm just trying out some new products. This is a new product I tried. I'm not sure if I like it too much, but it's less definition than I like. It's more fluffy, but it's cute. So I hope you guys enjoyed that, and I will see you in my next vlog or my next tutorial or whatever else I put up. So be sure to like this video, share, comment, subscribe. Be sure to follow me on Instagram or Facebook at Parisin85. And also follow me on Instagram, my family channel. You know, I gotta hurry up because the baby's crying. He wants mommy. Parisin85 living, Parisin85 living. And also follow my Instagram for fitness and health inspiration at FitWhit365. Fit FitWhit365. So I'll talk to you guys later. Bye.